Hello, everyone, and welcome back to English Daily Practice. I'm Alex. Excuse me.
And I'm Lana. Hi, everyone. Alex, are you okay? You don't sound very good today.
To be honest, Lana, I am feeling a bit under the weather.
Oh, no. That is a great idiom to start the episode, even if it is bad news. Under the weather means you are feeling sick. Not terribly sick, but not 100% healthy.
Exactly. I woke up this morning with a sore throat and a runny nose.
Poor Alex. A sore throat is when your throat hurts when you speak or eat. And a runny nose is when, well, you need a lot of tissues.
Yes, it is very annoying. So today, we decided to talk about this topic. It is not a fun topic, but it is very important.
We are going to talk about being sick, describing your symptoms, going to the doctor, and getting medicine.
This is essential vocabulary. If you are in a foreign country and you get sick, you need to know how to explain it.
So let's start with symptoms.
A symptom is a physical sign that shows you are sick. For example, my runny nose is a symptom.
Let's list some common symptoms. We often use the word ache.
A-C-H-E. It is pronounced like cake.
So we have a headache, pain in the head,
A stomach ache, pain in the stomach,
a backache.
and a toothache.
But be careful. We don't say leg ache or arm ache. For those, we just say my leg hurts or I have a pain in my leg.
Another common symptom is a fever.
A fever is when your body temperature is too high. You feel hot and sweaty.
In Fahrenheit, a fever is over 100 degrees. In Celsius, it is over 38 degrees.
We also have chills. This is the opposite. You feel very cold and your body shakes, even if you are under a blanket.
Often, when you have the flu, you have both fever and chills.
Alex, do you think you have a cold or the flu?
That is the big question. A cold, the common cold, is usually mild. You sneeze, you cough, but you can still walk around.
But the flu, influenza, is much worse. It hits you suddenly. Your whole body hurts. We call those body aches.
I think I just have a cold. I don't have a high fever. I just feel fatigued.
Fatigued is a fancy word for very tired or exhausted.
And I feel dizzy.
Dizzy means you feel like the room is spinning. If you stand up too fast, you might fall over.
Another symptom is nausea. Nausea.
Nausea is the feeling that you want to vomit. You feel sick to your stomach.
If you actually vomit, we use the phrasal verb throw up.
I feel like I'm going to throw up. That is not a nice feeling.
Luckily, I don't have nausea, just this terrible cough.
You should cover your mouth, Alex. We don't want to spread germs.
Germs are the tiny bacteria or viruses that make us sick.
And if your sickness spreads easily to other people, we say it is contagious.
Stay away from me, I'm contagious.
This is why, if you are sick, you should take sick leave.
Sick leave is time off work because of illness. In most jobs, you can call your boss and say, I'm taking a sick day.
It is better to stay home than to make the whole office sick.
Alex, I have a question about grammar. We use two different verbs to describe sickness, have and feel.
Yes, we say, I have a headache, I have a cold, I have the flu.
But we say, I feel sick, I feel dizzy, I feel terrible.
We don't say, I have sick. That is a very common mistake.
And we don't say, I feel a headache. We say, I have a headache.
Perfect. Now, let's talk about allergies. Sometimes you have a runny nose, but you aren't sick.
Yes, in the spring, many people suffer from hay fever. This is an allergy to pollen from flowers and trees.
The symptoms are similar, sneezing and itchy eyes. Itchy means you want to scratch them.
But for me, today, it is definitely a cold. I think I caught a cold from my nephew.
We use the verb catch for illnesses. I caught a cold. I caught a virus.
Or we use the idiom come down with.
I think I am coming down with something.
This means I am starting to get sick. It is that first moment when you feel tired and your throat hurts.
So, Alex, you were sick, you're at home. When should you see a doctor?
Usually, for a cold, you just stay in bed. But if it gets worse, you need medical attention.
Let's talk about the different types of doctors.
The main doctor you see for everyday problems is called a GP.
GP stands for General Practitioner. In the US, they often call them a family doctor or primary care physician.
If you have a specific problem, like a heart problem or a skin problem, the GP will refer you to a specialist.
But usually, you start with the GP.
So imagine I need to see the doctor. I cannot just walk in, I have to make an appointment.
In some countries, you can walk in, but in the UK and US, you usually have to call the receptionist.
Let's role play a phone call to the doctor's office. I'll be the patient.
And I will be the receptionist. Ring, ring.
Hello? I would like to make an appointment to see Dr. Smith, please.
Hello, are you a registered patient with this clinic?
Yes, I am. My name is Alex.
Okay, Alex, what is the appointment for?
I have had a bad cough for 2 weeks and I have a pain in my chest.
I see. The doctor is quite busy. We have an opening next Tuesday at 10 a.m.
Oh, that is too late. Is there anything sooner? It is quite urgent.
Urgent means it needs attention right now. Okay, let me check. We have a cancellation for today at 3 p.m. Can you come then?
Yes, 3 p.m. is perfect. Thank you.
Breaking character. That was a good example. Notice the question, what is the appointment for?
The receptionist needs to know if it is serious. If you say, I am bleeding, they will tell you to go to the hospital.
Yes, for emergencies, you don't go to the GP. You go to the ER, emergency room, or A&E.
But for a cough, the GP is the right place.
So you arrive at the clinic, you have to check in at the front desk.
And then you sit in the waiting room.
The waiting room is usually full of other sick people. It is the worst place to be.
You sit there reading old magazines until they call your name. Alex?
Then you go into the doctor's office. In the UK, we call it the surgery. In the US, just the office or exam room.
Now the doctor will ask you questions.
The most common question is, what seems to be the problem, or what brings you here today?
You describe your symptoms. I have a cough, I have a fever, etc.
Then the doctor will examine you. To examine means to check your body.
They might use a stethoscope, that cold metal circle they put on your chest to listen to your heart and lungs.
They'll say, take a deep breath, breathe in, breathe out.
They might also take your temperature with a thermometer.
And take your blood pressure. That's the band they put around your arm that gets very tight.
They might ask you to open wide.
Open your mouth and say, ah. This is to check your throat.
Sometimes they need to look inside your ears with a little light.
This is called a checkup, a general examination.
After the examination, the doctor gives a diagnosis.
A diagnosis is the name of the illness. You have bronchitis, you have an infection. It is just a virus.
It is just a virus is the sentence everyone hates hearing.
Why?
Because medicine doesn't kill viruses, you just have to wait.
But if it's bacterial, they can give you antibiotics.
Antibiotics are strong medicines that kill bacteria, but doctors are careful not to give them too often.
Alex, do you know the difference between a cure and a treatment?
A cure makes the sickness go away completely forever.
A treatment helps you feel better or manages the sickness, but might not fix it instantly.
Sadly, there is no cure for the common cold, just treatments to make you comfortable.
So the doctor decides what you need. She takes a piece of paper and writes on it.
This paper is called a prescription.
A prescription is a special note that allows you to buy strong medicine. You cannot buy antibiotics without a prescription.
A doctor might also give you a sick note for your work. This is proof that you were sick.
Okay, so you have your diagnosis, a bad cold, and your prescription. What happens next?
You have to go to the pharmacy.
In the UK, we often call it the chemist. In the US, the drugstore or pharmacy.
And that's a whole new set of vocabulary.
So we are heading to the pharmacy. This is where you get your medicine.
The person who works behind the counter is called a pharmacist.
You give them your prescription, they will prepare the medicine for you. We call this filling a prescription.
While you wait, you might look at the other medicines, the ones you don't need a prescription for.
We call these over-the-counter medicines, or OTC.
Things like aspirin, ibuprofen, cough syrup, or throat lozenges.
Lozenges. That is a funny word. These are the little hard candies that contain medicine for your throat.
I am sucking on a lozenge right now. It tastes like lemon and honey.
You might also buy painkillers. These are pills that stop pain.
Like paracetamol in the UK or Tylenol in the US.
Be careful with the dosage. Dosage means how much medicine you should take.
The box usually says take 2 tablets every 4 hours.
Or take with food, or do not drive after taking this medication.
Why not drive?
Because some medicines make you drowsy.
Drowsy means sleepy. You feel like you want to close your eyes.
That is dangerous if you are driving a car.
So Alex, you have your medicine. Now you go home to recover.
To recover means to get better, to go back to normal health.
We also say get over it. It took me 2 weeks to get over the flu.
While you are recovering, what should you do?
The doctor usually says get plenty of rest and drink lots of fluids.
Fluids means liquids, water, tea, juice. Staying hydrated is key.
And sleep. Sleep is the best medicine.
Sometimes people try home remedies.
A home remedy is a natural treatment, not from a pharmacy, like drinking ginger tea with lemon.
Or chicken soup. Chicken soup is famous for helping with colds. We call it Jewish penicillin.
Or putting a wet towel on your forehead to cool a fever.
Do you believe in home remedies, Alex?
I do. I think honey and lemon really helps a sore throat. It is soothing. Soothing means it makes the pain feel softer.
Let's talk about serious injuries for a moment, not just sickness.
Accidents happen. You might fall down and hurt yourself.
We use the word injury for physical damage to the body.
Some common minor injuries are cuts and bruises.
A cut is when the skin is open and bleeding. You might need a plaster in the UK or a Band-Aid in the US.
A bruise is when you hit your arm or leg and the skin turns blue or purple. It doesn't bleed, but it hurts.
You might sprain your ankle. I sprained my ankle playing football.
A sprain is when you twist the joint. It swells up. Swell means it gets bigger and puffy.
If it is very serious, you might break a bone. I broke my leg.
If you break a bone, you have to go to the hospital. They will take an X-ray.
An X-ray is a picture of your bones.
Then they might put your leg in a cast. A cast is a hard white shell that keeps your bone straight while it heals.
You have to wear the cast for weeks, and you have to use crutches to walk.
Crutches are the sticks you put under your arms to help you walk.
Or you might need stitches.
If you have a deep cut, the doctor uses a needle and thread to sew your skin back together. These are stitches.
Ouch, that sounds painful.
It is. That is why they give you anesthetic.
Anesthetic is the drug that makes you numb. You can't feel pain.
Local anesthetic numbs just one part of your body, like your finger. General anesthetic puts you to sleep completely for big operations.
Speaking of operations, we also call this surgery.
I need to have knee surgery. This is a serious medical procedure.
The doctor who does surgery is called a surgeon.
Let's hope we don't need surgery. Let's go back to minor problems. What about the dentist?
I hate the dentist.
Me too, but we have to go for a checkup every 6 months.
If you have a hole in your tooth, it is called a cavity.
The dentist will clean the cavity and put in a filling.
A filling is the metal or white material that fills the hole.
Sometimes they have to pull a tooth, extract a tooth.
This usually happens with wisdom teeth. These are the big teeth at the back of your mouth that grow when you are an adult.
Removing wisdom teeth is a rite of passage for many teenagers.
Alex, let's talk about mental health. This is just as important as physical health.
Yes, being healthy isn't just about your body, it's about your mind.
We use phrases like, I'm feeling stressed, I'm feeling anxious, or I'm feeling burned out.
Burnout is when you work too hard for too long and you collapse. You have no energy left.
If you are struggling with mental health, you can see a therapist or a counselor.
In English-speaking cultures, seeing a therapist is very normal. It is not something to be ashamed of.
It is good to talk to someone. A problem shared is a problem halved.
That is a great proverb.
Let's discuss insurance. This is a boring topic, but necessary, especially in the USA.
In the UK, we have the NHS, National Health Service. It is free at the point of use. You don't pay to see a doctor.
But in the USA, healthcare is private and very expensive. You must have health insurance.
You pay a monthly fee, premium, to the insurance company. Then, if you get sick, they pay the doctor.
But you might still have a copay. This is a small amount, like $20 or $50, that you pay every time you visit the doctor.
Or a deductible. This is the amount you pay before the insurance starts paying.
It is a very complicated system. If you're traveling to the USA, make sure you have travel insurance.
Definitely. If you break your leg in America without insurance, it could cost you thousands of dollars.
It could bankrupt you. Bankrupt means you have zero money left.
So always check your insurance policy.
Let's lighten the mood a little. How do we stay healthy so we avoid doctors?
Prevention is better than cure.
That means it is better to stop the sickness starting than to try to fix it later.
We talk about a balanced diet, eating fruits, vegetables, and protein.
And regular exercise.
And vitamins. Some people take a multivitamin pill every morning.
Or supplements like vitamin C or zinc.
Also, washing your hands. This is the #1 way to stop germs.
Especially during flu season, the winter.
You can also get a vaccine or a flu shot.
A vaccine teaches your body how to fight the virus. I got my flu shot yesterday.
Some people are afraid of needles. We call this needle phobia.
I don't like needles, but I prefer a needle to the flu.
Me too. A tiny scratch is better than a week in bed.
Alex, let's talk about the phrase calling in sick.
This is when you phone your boss. Hi, I can't come to work today.
Sometimes people fake being sick.
We call this pulling a sickie in the UK.
I pulled a sickie on Friday because I wanted a long weekend.
That is naughty. If your boss finds out, you will be in trouble.
But sometimes people take a mental health day. They are not physically sick, but they are too stressed to work.
This is becoming more acceptable in modern companies.
Let's do a quick vocabulary check on body parts that often hurt.
We mentioned head, stomach, and back. What about joints?
Knees, elbows, wrists, and ankles.
My knees ache when it rains. Old people often say this.
Or I have a stiff neck.
Stiff means it is hard to move, usually because you slept in a bad position.
Or I pulled a muscle.
This happens at the gym. You lift something too heavy and your muscle tears a little bit. It hurts a lot.
You have to put ice on it to reduce the swelling.
RICE. That is the acronym for injuries. Rest, ice, compression, elevation.
Elevation means lifting it up. Put your foot on a pillow.
We are learning first aid today.
First aid is the immediate help you give before the ambulance arrives.
Do you know CPR?
Cardiopulmonary resuscitation, pushing on the chest to restart the heart. I took a course once, but I hope I never have to use it.
It is a good skill to have.
Alex, what about describing the sound of sickness? A cough?
A sneeze, achoo.
When someone sneezes, what do we say?
In English, we say, bless you.
It comes from God bless you, but religious or not, everyone says it. It's polite.
If you don't say bless you, it seems a bit rude.
Other sounds, wheezing.
Wheezing is a high whistling sound when you breathe. This happens with asthma.
Or sniffling.
When your nose is runny and you keep sniffing, it is very annoying for people sitting next to you.
Please use a tissue. Blow your nose.
I need to blow my nose.
Much better.
Alex, let's talk about describing pain intensity.
Good point. The doctor often asks, on a scale of 1 to 10, how bad is the pain?
1 is mild discomfort. 10 is the worst pain imaginable.
We can use adjectives like mild, moderate, or severe.
Or excruciating. That means unbearable pain, level 10.
I have an excruciating headache. That's a migraine.
Or sharp pain versus dull pain.
A sharp pain feels like a knife, a sudden stab.
A dull pain is an ache. It is constant and heavy, but not sharp.
Or throbbing, like a heartbeat. Thump, thump, thump.
My finger is throbbing.
Being able to describe the pain helps the doctor diagnose you correctly.
If you just say it hurts, they have to guess.
So practice these words: sharp, dull, throbbing, burning, stinging.
Stinging feels like a bee sting, or when you put alcohol on a cut.
Let's move on to the pharmacy aisle again. We have creams and ointments.
These are for skin problems, rashes,
A rash is red, bumpy skin, maybe from an allergy or poison ivy.
You rub the cream on the skin. This is topical medicine.
And drops, eye drops or ear drops.
Liquids you put in your eye or ear.
And inhalers for asthma, you breathe the medicine in.
We have so many ways to get medicine into the body. Pills, liquids, creams, injections, inhalers.
Modern medicine is amazing.
It really is. Remember in the old days, if you had a toothache, the blacksmith pulled your tooth out with pliers.
Don't remind me. I am very happy to live in the 21st century.
Yes, living in the 21st century is definitely better for our health. But Lana, before we finish, I want to talk about phrasal verbs related to health. We already mentioned throw up, pass out, and get over.
Let's review pass out. It means to faint, to lose consciousness.
It was so hot in the room that she passed out.
And come to. That means to wake up after passing out. She passed out, but she came to after a minute.
We also have fight off.
My body is fighting off a cold. This means your immune system is working hard to stop you from getting sicker.
And swell up.
My face swelled up after the bee stung me. It became big and puffy.
And finally, break out.
Usually used with skin, I broke out in a rash. Or teenagers break out in spots, acne.
These phrasal verbs are used by native speakers all the time. They sound much more natural than the formal medical words.
Instead of saying, I lost consciousness, say, I passed out.
Instead of saying, I vomited, say, I threw up.
Lana, let's do a final role play, this time at the pharmacy. You have your prescription.
Okay, I am approaching the counter.
Hi there, how can I help you?
Hi, I would like to pick up a prescription for Alex Smith.
Okay, let me check. Yes, here it is. It's for amoxicillin. Have you taken this before?
No, I haven't. Are there any side effects?
Side effects. These are unwanted effects of the medicine, like nausea or drowsiness.
Yes. Are there any side effects?
It might cause a little stomach upset. Make sure you take it with a meal. And you need to finish the whole course.
What do you mean, finish the course?
Even if you feel better after 3 days, you must take the pills for all 7 days. Otherwise, the infection might come back.
Okay, I understand. How much do I owe you?
That'll be $15, please.
Here you go. Thanks.
That was perfect. Finish the course is very important advice for antibiotics.
And asking about side effects is a smart question.
Lana, for our listeners who are living abroad, navigating the medical system can be scary.
It is. My advice is keep important information on your phone.
Yes, keep a list of your allergies, like allergic to penicillin.
And a list of any medicines you take every day.
And your emergency contact number, the number of your husband, wife, or parents.
In English, we often look for ICE in a phone. ICE. It stands for in case of emergency.
Paramedics look for the ICE contact if you are unconscious.
That is a life-saving tip.
Another tip, if you don't understand the doctor, ask them to write it down.
Doctors often use big words. It is okay to say, could you write the name of the diagnosis? Then you can Google it later.
Or bring a friend who speaks better English to translate for you.
That is called a chaperone, or simply a helper.
So, Alex, how are you feeling now? Has talking about sickness made you feel worse?
Actually, I feel a bit better. Maybe talking was the distraction I needed.
Or maybe the lozenge is working.
Probably the lozenge.
Well, we have covered a lot of achy and itchy vocabulary today.
Let's summarize the key takeaways.
1. Know your symptoms. Headache, fever, nausea. Know the difference between a cold and the flu. Know how to make an appointment. Understand phrasal verbs like pass out and get over.
If you mastered this vocabulary, you will be much safer and more confident when traveling or living in an English-speaking country.
We hope you never have to use these words. We hope you stay healthy.
But it is better to be prepared. Alex, do you have a challenge for our listeners today?
Yes, I want you to go to your medicine cabinet
The cupboard in your bathroom.
and read the labels on your medicines. Try to translate them into English.
Is it a painkiller? Is it an antiseptic cream? Is it cough syrup?
Learning the English names for things you already have is a great way to study.
And tell us in the comments, what is your best home remedy for a cold?
Oh, yes. Does your grandmother make a special tea? Do you eat raw garlic? We want to know.
Different cultures have amazing cures. Share them with us.
And maybe Alex can try one for his cold.
I am willing to try anything right now. Please help me.
Check the comments for advice, Alex.
Well, that brings us to the end of this episode of English Daily Practice.
Thank you for listening, even though the topic was a bit sneezy.
If you found this useful, please give us a thumbs up. It helps the channel grow.
And don't forget to subscribe. We have many more practical topics coming soon. Shopping, banking, travel.
Topics you'll actually use in real life.
Stay healthy, everyone. Drink your water, wash your hands, and get some sleep.
And take your vitamins.
See you in the next episode. Feel better soon, Alex.
Thanks, Lana. Bye, everyone. Bye.
Bye.